Let me say good afternoon to everyone, and let me also acknowledge Mayor Pro Tem Dave Martin, who's with me, and Councilmember Peck, and we are in District A, which is Councilmember Peck City Council District. And then pleased to have Congresswoman Sheila Jackson Lee. She's here before she boards her plane and returns to D.C. So thank you, Congresswoman, for being present. And then Sayed from UMMC is here as Sayed is also present. They are commanding this particular site. So I want to thank UMMC for their collaboration with the city. They've done so much on the testing side, and now they're collaborating with us on the vaccine distribution. Director Stephen Williams is present, as well as Dr. Persse is also here. So today, the City of Houston Health Department is opening its first Drive-Thru vaccination clinic in partnership with United Memorial Medical Center. Let me just say that this will be a daily site that will be operating Monday through Saturday from 8:30 till 5:30. And they'll be doing on average about 1,000 a day. And again, let me also say it will be by appointment only. So please don't just drive up. It will be appointment only, but this will be a stand-up site. And then on average about 1,000. Depending on the supply that comes into the city, that's given to the city health department, we can ramp up based on available supply. UMMC has been a leader in providing COVID-19 testing and caring for patients with the virus, and I want to thank them for working with the City of Houston to open the Drive-Thru vaccination site, making it more convenient for people with mobility issues and providing the vaccine services in this area of town. The health department received an additional 9,000 doses of the vaccine last Friday. In addition to scheduling this particular location, the department will transfer another 800 doses to other providers and fulfill exiting appointments at Bayou City Event Center, is Health Center, and Multi-Service Center. So in addition to Del Mar, which will be Monday through Saturday, 8:30 to 5:30. The Bayou Center is operating. The Sunnyside, the La Nueva Casa de Amigos site, as well as Sharpstown. And then as the supply ramps up, then we'll be able to expand to additional sites throughout the city. As we receive more vaccines, we will expand partnerships with pharmacies and federally qualified health clinics to ensure the vaccine is available in the most vulnerable communities and deploy more mobile strike teams as needed. I will say that we will be out in the Ailey Westwood area on Saturday as well, reaching out in that particular part of town. Our work to vaccinate as many people as possible is based on available supply. And I know there is a lot of anxiety in the community because people are worried that they cannot get an appointment schedule. Again, as frustrating as it may be, I want to encourage people to be as patient as possible. We know that the demand is higher than the supply, and that there's a high demand for this vaccine, which is good. But everyone is working on every level, from the feds all the way down, to increase that supply. That is why also in part my Office for People with Disabilities is working closely with the Houston Health Department's Aging and Disability Resource Center to ensure that people with disabilities and seniors have access to vaccines as quickly as possible. People with disabilities and seniors can call 832-393-5500, 832-393-5500 to be put on a COVID-19 vaccine waiting list. It is very important that you share the number with people in your network because we know the elderly and those with disabilities have a tougher time accessing the appointment portal once it is open. You can also call the Area Agency on Aging, to be put on an appointment wait list if you are also over the age of 65 years of age. And that number is 832-393-4301. That is the Area Agency on Aging. 832-393-4301. We are limited by vaccine availability, but we are doing everything we can to use the resources that we do have and to make that available and to do it in an equitable fashion. As you wait, please continue to do your part to stop the virus from spreading. That means you should continue to wear a mask, practice social distancing, wash your hands frequently, and get tested. Today, unfortunately, the Houston Health Department is reporting the largest number that it has ever reported in a single day. And so today we're reporting 3,039 cases of COVID-19, bringing the total case count for the city of Houston to 148,515. And let me quickly add, that is due to some corrections that the systems have made over the last 3 days. As you know, like yesterday, the report was 267. And so they have corrected those numbers over the last 3 days, and that explains why this number is so high. So today we are reporting 3,039 new cases of COVID-19. We are also reporting 11 new deaths as a result of COVID-19. So 11 more persons in our city have died. And we are now currently operating with a positivity rate in the city of 17%. Now, let me just say, even though the number is high, the 3,039 that I'm reporting today, when you look at the more granular data, it does reflect that things are improving slightly. So, for example, the reproduction rate, that number is at this morning, as of this morning, 0.82. Which means that the virus is not spreading as much. It's under 1. The number of people, for example, in our hospitals, now in this 9-county area, which includes City of Houston, Harris County, that number has gone down from where it was. Instead of being 2,200, the number's a little over 2,000. So that number is starting to go down. The number of people in our ICUs, that number is starting to go down. So many of these other indicators suggest that things are getting slightly better. I don't want to overstate that, because you really have to look at like a two weeks period, a 2 week span of time, 14 days. But it does show that things are getting slightly better. But again, that depends on our behavior and how we work collectively to get on top of this virus. But the virus is very much still in the community. I want us to be mindful of that. Testing is still very important. Testing, wearing these masks, the social distancing, all of that's important. And then at the same time, we will do our very best to get these vaccines out as quickly as possible. Let me yield, and let me bring on Dr. Persse today to speak to what's happening as it relates to this virus, and then he'll be followed by Director Stephen Williams. Dr. Persse.
Thank you, Mayor. Congresswoman, good to see you again. So the Mayor has given the numbers. I want to remind everyone, as the Mayor pointed out, that the data is showing some improvement, which is obviously very good and welcome. I don't want anyone to think that that's because the vaccine is solved it. Very, very few people in the community compared to the entire population have been vaccinated, and so we need to continue to wear our masks and social distance. And in fact, it is most likely that this change in direction of the data is because people are changing their behavior. Perhaps during the holidays, people dropped their guard and we took some risky behaviors that we otherwise might not have, and now that the holidays are past, people are getting a little bit more diligent. So those things, wearing your mask, social distancing, they make a huge difference. And so I want to echo the Mayor's comment that that's what we should do. The other thing to let folks know is there's been a lot of confusion and a lot of anxiety about the vaccine and getting second doses. And so with the Pfizer vaccine, the second dose is due on 21 days after the first. And with the Moderna vaccine, the second dose is due 28 days after the first. For both of those vaccines, they said in the very beginning, they gave a little bit of a leeway that if you could get vaccinated up to 4 days early from that date, and that would be fine. But that's not the question people are asking, because there is some angst about you being able to get in and get your second dose. And so The manufacturers in the beginning have said that you could also get vaccinated as late as 4 days after that date. That guidance has changed slightly from the CDC. The CDC is now putting out some guidance that may be confusing to people, and so I want to make sure I'm very clear about this. It is still ideal for you to get your second dose just as close to the 21-day or 28-day scheduled second dosing that, depending whether you get the Pfizer or the Moderna vaccine. You should still strive to get your second dose as close to that date as possible. However, the CDC has now said that they believe that up to as many as 42 days after the initial dose may be a window during which people shouldn't have to worry too much, that there be expectation that the vaccine will work just fine. And so if you're not able to get vaccinated exactly on 28 days or 29 days after the Moderna, but you should get it on day 30, day 31, day 32, something like that, I wouldn't lose any sleep over that, okay? But I also don't want people thinking, oh, I don't need to worry about getting a second dose. You absolutely do need to focus on getting your second dose. We know from the data that the first dose primes your immune system, but it's the second dose that really drives home the stimulus to your immune system to make you immune. So again, don't let this new guidance confuse anyone. Try to get it on the date that it was assigned, but if you're a couple of days late, don't lose any sleep over that.
Okay, thanks.
Thank you, David. I want to first start by thanking UMMC, Saeed, Dooney, for their willingness to open up this drive-through site. We at the health department had actually piloted a drive-through site, but what we recognize is that we could probably reach more people if we can partner with other folks to expand our footprint within the city of Houston and Harris County. I'm also going to talk a little bit about some things that we really need to be responsive to. The mayor, and reiterate, the mayor mentioned that at our clinics, we don't want people to just show up. We recognize that as people go on our registration site when it's opened up, that people might get a QR confirmation code. But oftentimes they leave the site without getting a confirmed time and date. And we're saying that if you don't have that date, and if you don't have that time, then actually you're not registered. So please don't show up. We're working diligently to set appointments and to really get vaccines in the arms of as many people as possible. We recognize that due to the scarcity of vaccine, that there's a lot of frustration amongst people who want to get vaccine. We will do the best that we can, but we ask people to please be patient with us and know that as time goes on, more vaccine will become available. And on the second dose, and I really appreciate David actually explaining that there is a larger window for getting that second dose than most people understand it. It is up to 42 days. As a matter of fact, with the Pfizer vaccine, their test does expand it actually up to 43 days. If you're vaccinated by the Houston Health Department, we're going to reach out to you within the appropriate time frame to get that second shot. I want you to continue to check your emails, your voicemails, and your text messages from us, because we're going to reach out to us. I've even had people to contact me when they in fact have voicemail messages to schedule their appointment. So please be on notice that we will contact you. If your contact information has changed after you've received the first dose, we're asking you to call our call center to make us aware of that so that we can adjust appropriately. This week, we plan to give a total of more in excess of 10,000 doses through our clinics and through our partners. But as the mayor said, we're also going into the A-Leaf area and partner with Hope Clinic and Ibicina Clinic to ensure that more vaccines are available on Saturday and Sunday. We'll continue to expand our footprint as vaccine become available. We're working not only with FQHCs, some pharmacies, but been on the call with Harris Health, really trying to utilize their system, especially within the city of Houston and certain neighborhoods to ensure that vaccine is available around the corner from a lot of our residents.
Thank you, Dr. Williams. What I want to emphasize is that the more supplies we get, the more we're able to do, even at this particular site, because the capacity, the infrastructure is available to do exponentially more. Everything is predicated on the supply. The same thing, we can expand the number of sites within the area based on the supply. The other thing that I really want to hit home, because with respect to that second dose, please, we're asking people, number one, the health department will call you. But if you haven't received a call, for example, please don't start reaching out to us unless you're within that, let's say, like a 48-hour window before that 28th day period is about to hit, or the 21 period if you're with Pfizer. But the health department's goal is to reach out to you. Please do not call, for example, if you're 10 days out, okay, before that second dose is available. Please don't do the calling. That will only make things more difficult for everyone. And so bear in mind, we're still having to give people their first shot, and there's a huge demand for that. And then, of course, scheduling for the second shot. So on the second shot, we will call you. But if you haven't heard anything from us within, let's say, a 48-hour period, then reach out to us. Now let me call on Congresswoman Sheila Jackson Lee.
Thank you, Mayor. May I applaud you for being a pilot or an example for the nation in how to distribute massively the doses that you are getting. So let me thank you and thank your partners, UMMC, the City Health Department with Mr. Williams and Dr. Persse for coming together around ensuring the widespread distribution of what you have. The federal government is committed to ignoring any rumors that have been presented that they would be stretching out the first dosage and not committed to getting the second dose. So I want to say to the mayor that it is our commitment that you will have your second dose to be able to provide to those who have courageously and willingly registered to secure the vaccine in order to stop the community spread, because we recognize that the mutations are coming. Some are already here. Some have been determined to be contagious but not deadly, and some are now speculated to be both contagious and more deadly. So we want to make sure that everyone knows to follow the protocols that the city has put in place, and that there will be a second dose as distributed by the federal government. Everyone knows that we are now reviewing a $1.9 trillion package that includes the additional funding for more staffing, additional funding for more testing and tracing, and vaccines. And that we are about to run through our gamut, run through our tracking system with the FDA for an emergency waiver, Johnson & Johnson. So we are on point for responding to the needs. And one of the representations that I will make to the COVID-19 task force organized by President Biden is that cities that can stand up sites can receive directly, and counties, their vaccines, that they do have the infrastructure to receive it. And we would like to advocate for some cities across the nation, like Los Angeles and Houston and New York, which is suffering, that they would receive their vaccinations directly. We also want to take note of the fact that there is a commitment to help local governments stand up schools, close to $160 billion, I believe, that will be focused on testing everyone in the schools and teachers and otherwise to work to make sure that we stand up the schools, which I believe is extremely important to do. So I would just try to reinforce one point. Someone asked me, well, didn't you get vaccinated? I did it publicly because as a member of Congress, it was part of our responsibility as the continuity of government. But while you're wearing a mask, whether you're vaccinated or not, please continue to wear that mask, socially distanced, and washing your hands. If you're not vaccinated, again, the city has multiple testing sites. And so I say, get tested while you wait to get vaccinated. I was trying to get it rhyming, but get tested while you're waiting to get vaccinated, because you can also be tested for free as you are getting vaccinated for free. So if you're not vaccinated, you're still susceptible to being anti-symptomatic and contagious. That means you have no symptoms, but you are spreading it to somebody else. Please continue to get tested. And Mayor, I'll continue to stand up these testing sites. I want to acknowledge our council member for this area, Councilmember Peck, for her leadership, and our Mayor Pro Tem is right there, and my neighbor and Councilmember Cisneros. I think I've gotten all of them. Well, I think I've gotten all of them. And I thank you, Mayor, for having a team that's ready to do everything they can. And the UMCC team, I want to again thank you. Thank you, Dooney Hebram, as well. I call her doctor, but she'll soon be that. But I do want to make sure, let me finish by saying, we are now looking at the $1.9 trillion budget. Mayor, I want you to know that your money for local government is absolutely there. And we will absolutely provide local government with that funding that we have been working on for very long. We are possibly having to do this through budget reconciliation, which is an expedited process. And for those listening, we will also have the enhanced $1,400, and we'll be looking closely at those workers making under $40,000, which have been suffering. So please, don't hesitate on your second dose. Don't be fearful. Follow the protocols of the city, and also continue to get tested. And we are assured that you will get the doses for your second dose. And we are also trying to assure a readily organized distribution of the vaccines, that you will know a schedule by week or bi-weekly when your vaccines will be coming in. So thank you so very much, and we can all do this together.
Thank you, Congresswoman, and we are absolutely waiting on the local assistance and absolutely need it. So thank you so very much for your efforts. Again, Councilmember Cisneros, I apologize. I didn't acknowledge you. So thank you so very, very much. And then, of course, Chief Pena. Chief Pena, anything to add to this report? Okay. And